Good morning, everyone. Thank you for taking the time to join us on a Saturday morning. My name is Pooja. I will be the host and facilitator for today's webinar. On behalf of AWA, a warm welcome to our 14th AWA Inclusion Expert Series. It's our second for this year. The Inclusion Expert Series started in 2018 as a way to bring together professionals from diverse backgrounds within the education space. Through this series, we hope that professionals from mainstream, inclusive, integrated, and special educational settings will have the opportunity to glean insights, acquire new inclusion-related information, and enhance their skill sets. So hopefully we can all use that to mindfully work towards practicing better inclusion wherever it is that we are doing our work. Today's session is special for two reasons. It will be our first expert series session to feature a panel of speakers entirely from Singapore. And secondly, it seems that more than half of our participants today are SEN officers or mainstream school teachers, which is slightly different from our usual crowd. A very warm welcome to you. And we hope to have you join us for future sessions as well. And of course, a warm welcome to all our preschool teachers and other participants as well. Before we start, our speakers would like to find out a bit more about your backgrounds and your familiarity with ADHD. That's our topic for today. So you're going to see 3 questions appear on the screen now. Could you just help us pick the choice that applies best to you? You should be seeing the screen up now. And while all of you are filling those questions out, you'll be seeing 3 questions. I'll also just go through some housekeeping rules so that we can enjoy the session better together. Today's session starts at 9 and ends at 11:30. We'll have a break around 10:05 or 10:10. Participants will be muted during the presentation, but you're welcome, of course, to post your questions. There's a Q&A box. You should be able to see that on the bottom of your screen. We will have our speakers engage us during the Q&A segment at the end to respond to as many of your questions as they can. And at the end of the session, the presentation slides will be available for you to download. So don't worry about, trying to take notes or trying to read every single thing on the slide. We have a lot of information for you today. Please do download the slides when we give you the link at the end. I think we can move on to the next question. Okay, and I think we've got a pretty good response rate. Maybe we'll just wait for a couple more minutes because I think there are people still trickling in. Okay, I think we can go ahead and share the results of the poll. I will also go ahead and introduce today's session. So today it's going to be about how we can empower ourselves so we can empower our students with ADHD. We're pleased to present this session in collaboration with Unlocking ADHD, a Singapore social service agency whose mission is to empower ADHDers and their families to live life to the fullest. They do this by providing peer support groups, workshops, group coaching, and access to resources and much more. Today, we're honored to have with us 3 speakers from Unlocking ADHD. You can see that on your screen. We have Ms. Moonlake Lee. She's our founder and executive director of Unlocking ADHD. Moonlake has worn many other hats, including lawyer, healthcare marketeer, investor, mentor, runner, and community builder. She was diagnosed with ADHD at the age of 50, following her own daughter's diagnosis. We also have with us Ms. Jannah Ahmad, an educational therapist who works in the Department of Child Development at KK Women's and Children's Hospital. Jana has over 10 years of experience working with preschool children, including those with learning differences like ADHD and dyslexia, and she's previously worked as an early childhood educator. We also have with us Ms. Vagni Lachmikantan, a learning support integrator who has worked in the field of education for 26 years. She's currently working as a learning support integrator at an international secondary school in Singapore. And what all three of our speakers share in common is the passion to help each child discover and nurture their unique strengths and talents and maximize their potential. And that is something that drives all of us at AWA too. So we're really honored to have the three of you with us today. I'll just go over the program briefly before we start. Moonlake will start us off with an introduction to ADHD, followed by Jana's sharing on how to support executive function skills. We will take a short break around 10 a.m., followed by Vagini's sharing on supporting social emotional growth. Moonlake will then share some useful resources, after which we hope to have at least 30 minutes for the many questions we're sure all of you will have. And we will end at 11:30 sharp. Can I check with my colleagues if we can flash the poll results up? So as you can see, we have a lot of educators with us today, probably almost all educators. So preschool teachers, primary school teachers, and other educators, which I believe would probably be where all the SEN officers are indicating themselves. And most are either have limited knowledge or consider themselves familiar. And yes, we are all facing challenges managing children with ADHD in our classrooms. Okay, so I think that sets the stage, Moonlake. Over to you, please.
Okay, and there are three main types of presentation of ADHD: hyperactive, impulsive, inattentive, and a combination of the two. Hyperactive impulsive tends to be mainly boys, little boys, because they're more active and disruptive in the classroom. But girls tend to be a bit more inattentive, and that's why frequently they're overlooked. So it's important as well for educators to keep an eye on some of the inattentive symptoms so that we can have an earlier intervention if needed. Okay, so, and many people actually have a combination of both types of presentations. The impact of ADHD, generally worldwide, is estimated about a 5% prevalence rate. Singapore doesn't have official numbers, but it's about there. We actually think it's higher than 5%. In the US, the numbers are about 9 to 11% prevalence rate. So if you think about our population, actually then it could potentially affect about 272,500 or more, okay, of people in Singapore, which is quite a lot. And it's not just impacting the individual, but also those around them. So actually then if you think about potential impact, it is a lot larger than at 5%, because as parents, teachers, classmates, spouses, colleagues in the workplace, it could actually go quite high. And more than just the classroom or the learning years, ADHD actually has a broader implication because it impacts other things in our lives, particularly things like relationships, and also in terms of the impulsivity might affect other things such as getting into trouble, and later on, if it isn't addressed, getting into issues with the law. There's also research that shows that it impacts on family relationships where there's more stress in the household, and therefore actually 3 times higher rate of parental divorce or separation. For those of you who are working with parents or yourselves are parents of ADHD children, you probably understand this. I myself am an adult ADHD diagnosed at age 50. My daughter is ADHD, and we definitely see a lot of the conflict in our own lives too. So that's one of the reasons why we're trying to do more awareness so that we can help families that need this kind of support. The key thing about the chart on the left is that, the earlier that we can intervene, the better it is to minimize other related aspects of ADHD, because the later that is diagnosed, then other factors kick in, including learning issues and also mental health issues. ADHD affects relationships. There is some research out there to say that children by the age of 10 with ADHD hear about 20,000 more negative messages than those children that don't have ADHD. And I definitely saw it in the case of my own daughter as well, because there's a lot of scoldings from teachers, tuition teachers, at home, from parents, from helpers, and so on. So you can imagine the impact by the time the person is an adult. And that's something quite sad, actually. And in terms of school, 52% of children with ADHD were actually rejected or excluded by peers. It could be as simple as, trying to choose partners, for sports, or even like, choosing people for group work. And that rejection actually affects the self-esteem even more. What is important is to understand what the ADHD wiring is like. It is different from children without ADHD, and ADHD primarily is based on an interest-based system. So if a child is interested in something, they can really drill into it and hyper-focus and become so-called subject matter experts. But if there isn't an interest in it, it's very hard to get engagement. People that don't have ADHD, they tend to be more on a priority-based system. That's why it's easy to see what's important and go and do it. Whereas for the ADHD, sometimes things that seem obvious are not that obvious for them. The best way to describe how the ADHD wiring works is actually the phrase given by Dr. Edward Hallowell, a world-renowned psychiatrist who actually has ADHD himself. And he described it as a Ferrari engine for the brain, okay, but brakes that are the bicycle standards. So a Ferrari engine with bicycle brakes. So that inherent strengths in the individual, but because of self-regulation issues, the brakes are not strong enough. So he said that his mission was actually to help strengthen the brakes so that the car could do its job and win races. So as educators, as parents, what we are passionate about is trying to come up with those structures to help strengthen those brakes so that our children can actually win those races that they were meant to win. Okay, there are some very common questions that people ask about ADHD, like, if you are smart or gifted, could you have ADHD? And the answer is yes. Okay, there's a category called twice exceptional, or 2E. Folks that actually have ADHD wiring, but because maybe they were born with a higher IQ or other gifts in sports or creativity, they can actually do well in life. But sometimes the ADHD could result in hiccups, and that's why they're not performing at the level that they're capable of. ADHD frequently comes with other conditions. It's called comorbidities. About 70–80% of people with ADHD have at least one or more other conditions. The most common actually is anxiety and depression, okay, in terms of the mental health side. And in terms of the learning side, dyslexia, ASD, social skills issues, about 30–50% sometimes overlap. So that's why when we say special education needs, right, and the trifecta of ADHD, dyslexia, ASD, you can find sometimes people exhibit all three or two out of the three. So that's important to realize in terms of the early intervention. And again, what does cause ADHD? There's actually a very strong correlation genetically. So that's why many people in the Unlocking ADHD community, myself included, were diagnosed as adults after our children were diagnosed, because we suddenly saw that there were certain symptoms that our child had that we had as children. So it's important for parents to understand that, and also self-care. Go for a diagnosis, manage your own ADHD symptoms so that you can be in a better position to support your child. I always call it the airplane analogy, airplane safety video analogy, where you put the oxygen mask on yourself before putting it on the child. Okay, siblings also have a chance of having ADHD. However, there are also some very positive parts about the ADHD wiring. Resilience is one of them, being empathetic. There's some articles that say that ADHDers tend to be social justice warriors. So that's great. It is deployed in the right direction. And so therefore the sense of justice or injustice is pretty strong. So in terms of even like punishing or disciplining a child, please keep that in mind. ADHDers tend to be risk takers. They're intuitive, definitely energetic. I'm more hyperactive, as you can maybe tell by now, spontaneous, and also they have a sense of humor. So these are the things to affirm and to encourage so that it really builds up the person. I'm sharing this slide, which was taken from the How to ADHD videos on YouTube. And this is how ADHD typically presents in schools. That you might see the impulsivity, hyperactivity, inattention, people blurting out, talking back, having issues with emotional regulation, not being able to sit still, fidgeting, disorganized. And What people don't see though is below the iceberg, okay? And what is causing these kind of symptoms? And that includes weak executive function, which my colleague Jana would share more about. The difference in brain, the way the brain works, and that impacts again the behavior. Definitely the impaired sense of time is something that we all struggle with, myself included. It was the cause of a lot of friction between me and my husband. And it definitely affects the workplace as well. There's also sleep disturbances, very, very common in people with ADHD. And not learning easily from rewards and punishment. Sometimes, as a parent or even as an educator, when there's discipline, it is so obvious that the consequences are so negative. Why are people still repeating the behavior? Well, these are some of the reasons. Again, as Pooja said earlier, we will be sharing the slides with you, so you can go through it in more detail later. And we canvass our community and we ask them, what are the things that you wish teachers knew that could support you better? And so these are some of the summary that we came up with. The first one is that any student can have ADHD. So it's not just those who are struggling in class. There might be some that struggle less, but they still have ADHD. Again, boys at an earlier age are more likely to be diagnosed than girls. And ADHD actually also exists in elite schools, okay? And faculties like medical school, dental school, law school. I know so many professionals in these areas with ADHD, okay? Very important to know that we try our best. We actually work 3 to 4 times harder than normal just to try to keep up. So sometimes it is not an issue of being lazy. It may not show in the results, but the effort is there. And that's important to remember. One of the very well-known ADHD coaches shared that we need to understand the difference between I can't and I won't, okay? Because when it's I won't, and we see it as an I won't, we think of it as a willpower thing, and therefore, we get scolded or, have discipline and consequences. But if it's an I can't situation, then actually it needs support. So in the case of ADHD, many times it is I can't. So we have to ask ourselves, right? What is the struggle here? How can we support them and make things a bit more manageable for them? We talked about the 20,000 negative feedback, right? That's why there's low self-esteem for many of them. Okay, and we really need help, not punishment, because with the right support, we can really thrive. I also understand that, from our interactions with teachers, one of the big challenges actually is communicating with parents. Because sometimes the kind of response when you bring up a potential ADHD child in terms of the symptoms in class, some parents deny it. There might be anger, defensiveness, apathy, anxiety, curiosity, and even amusement, not taking it seriously. And so teachers tell us they struggle because they're not sure how to bring it up in a way that would actually have a certain action taken. So some things that we thought might be helpful is don't call it ADHD, because the only people that can diagnose as ADHD are the professionals, the psychiatrists, the psychologists, the pediatricians, right? But we can talk about the symptoms because people understand that, and that's no stigma or no labeling, no association with that. So we're addressing symptoms because we're trying to problem solve here, right? Give specific examples of symptoms in your child's life. And then also parents need to know that they are being supported. It's a team approach. So let them know that you're on their side to work with them again to support your child. If you have home support tips, and we will be providing as well in the handouts here, that's also good to share with the parents. And maybe a follow-up meeting a month or a couple of weeks after, just to see whether anything is being done. And do note this conversation too in the child's records, because maybe when the parent takes the child for a diagnosis, the doctor would like to know some specific input from the school. So, having this documented would be very helpful. And some of the common questions would be, if people think that they have symptoms and they want to get diagnosis, they don't know where to go. So there are differences between going to the public system and the private system. Definitely cost would be an issue. And the other would be, of course, waiting time. So, I put an asterisk there because we did a survey, back in late 2021 about the how long it takes to, get a child into the public system. At that time, the indication was 3 to 6 months. But I understand that more recently, it takes even longer. So if you suspect that there might be issues with a child in your class, or if you're a parent with your own child, and you want to go to the public system, I would say sooner better than later, because there might be a longer wait time. Cost-wise, definitely a little bit more affordable, 60 to 600. On the private side, definitely much faster. It could be as fast as 1 week to 3 months. But of course, the cost will be higher. The reason for the variation in cost is depending on who you see. Psychiatrists normally are the front line, and they actually efficiently can also provide medication if needed. But psychologists would tend to take longer because they do more testing. And that's very important, especially for students, because we also want to understand where the learning issues are. So because of the extra time to do all the different testing and the reports, that's why the fee is higher. Okay, I would say actually for students, if finances or opportunity allows in terms of whether it's public or private, it would be good to get an educational psychology assessment to understand learning. And then if medication is indicated, which it usually is as a first line, then you would need to see a psychiatrist. There are benefits of getting an earlier diagnosis and intervention. And that is, number one, is really the clarity of condition. There's no guesswork needed. Once you know what the issue is, then you can address it. And also specifically when it comes to the assessment, you have an idea what learning needs are, and you can get these specifically supported, because some common learning issues too, again, would be the dyslexia, but some other less commonly known ones would be things like dyscalculia. So dyscalculia is those that are struggling with numbers. I'm definitely one of those. I work very hard, but I just can't grasp it. So, identifying those early and actually addressing it can actually change the future trajectory of a child, because instead of hating math, for example, if they have dyscalculia, they could learn how to understand it and cope with it. And then maybe more future fields are open to them. Dyspraxia, learning, writing issues, also very common. The other thing about a diagnosis is that you can connect with others in the same journey. You can search, Google it, because you can search the condition name. And that's how you also get the additional support. Medication, as I said, is pretty important, because medication is pretty much like a tool, like a toolkit. It's one of the most efficient and effective ones. About 70+% of people who take meds actually benefit from it. But there are, of course, a certain percentage that either have allergies, complications, or they just decided that that is not for them. That's fine too. But the best way to think about medication really is the eyeglasses analogy. I'm at the age where I need glasses to read. And if I don't have glasses, I can still read, but I'm using way more effort to try to make out the words on the page. So if you're a child, think about the energy instead of spending time trying to make out words, actually spending that time learning instead. That's a very big difference. So please go to our website to learn more about medication, so you know the clear picture, you can make an informed decision. The diagnosis helps access learning and access school accommodations. So that's important, particularly for the exam years, so that the child can perform in the best conditions. And finally, early intervention reduces risk of comorbidities developing. Early intervention can maybe reduce the chance of anxiety and depression, which are very common for those with ADHD. In terms of where to get a diagnosis, if you scan the QR code at the bottom left of the screen, that's our YouTube site. We did an event back in October 2021 when we launched on the diagnosis and management of ADHD in children and teens, featuring an esteemed professional panel, giving different aspects of their perspectives on ADHD. And in terms of where a parent or teacher is, go out to your SEN officer, your teacher, reach the GP, pediatricians. These are all the lists of potential folks that could direct you and help you to get the diagnosis needed for your child. In terms of ADHD medication, again, consider it as a first-line treatment. Don't rule it out, because sometimes if we don't get the effective help needed, the learning gets held back. And each year that is held back is harder to catch up. Okay, so there's a lot of myths about medication. It is not addictive. A lot of people think that it's addictive. It is not, because many ADHDs forget to take their medication. So very important to remember, it's not addictive. In fact, some research by Professor Willens from Harvard in the US shows that children who take stimulant medication or non-stimulant for ADHD earlier on actually have a reduced chance of drug abuse when they're older. Because when a person has ADHD, they have a lower dopamine level. They're looking for stimulation. And sometimes when they can't get it through the prescribed medication, they self-medicate. And self-medication includes things like overdosing on coffee, or when they're older, alcohol, drugs. and so on, smoking. So these are the less healthy alternatives. So medication, at least taken as prescribed, will be helpful. We talked about the glasses analogy earlier, about, wearing glasses helps you see better without that much effort. And same way as glasses, when you take the glasses off, you're back to square one again. So we always say that pills don't teach skills. So medication alone is not sufficient. Medication needs to be combined with therapy for if there's any mental health issues, and also combined with behavior management, whether it's through coaching, or creating the environment that's more conducive for the child, and also to encourage things like better sleep, better nutrition, exercise actually is very important as well. And of course, having a support group. Psychiatrists and psychologists, the difference is that psychiatrists are the only ones that can prescribe medication. We normally recommend a hybrid approach for those that may be having financial considerations. If time is an issue, especially for those in the exam years, go and get a private clinic to diagnose first. And if there's medication, to sort out the medication before you go back into the public health system. That would be the most efficient cost-wise and time-wise. Bear in mind that medication doesn't have to be for life, and you don't have to commit right away when you don't know much about it. There is something called a medication trial. You can try it for like a couple of weeks to a month, note all the different effects in terms of side effects as well as the positive effects, and then talk to your doctor, because ADHD medication is not like a Panadol or antibiotic. There is a process of calibration. I'd recommend Dr. Dan Shapiro's Parent-Child Journey resources. Just go to his website, Parent-Child Journey. He's a pediatrician that specializes in challenging children, and has a lot of free resources there and webinars. And finally, don't mix your medications with things like orange juice and acidic drinks, because it actually dilutes it. But my time is up, and I really want to make sure that you also hear my colleague Jana's case studies and tips on executive functioning. So actually, I will be passing the time over to Jana. Jana, ready to jump on right now?
All right, thank you so much, Moon. So I'll be sharing more about practical strategies on the upcoming slides on supporting children with ADHD in the classroom. Okay, so just thought that it may be good to mention that some of the strategies may not only be applicable to children in kindergartens, but can also be helpful for children in primary school. Okay, so I guess just let me briefly introduce myself. I'm currently an educational therapist at KK Women's and Children's Hospital at Department of Child Development. So I work in this transdisciplinary team to support young children with a range of developmental delays. So I've also worked as a preschool teacher previously for about 10 years. And I volunteer with Unlocking ADHD as I connected with Moon. And I think the work that they are doing is really impactful. Also, I'm a mother to two lovely boys, and I think it helps me gain a different perspective on understanding children, the challenges of parenting when I became a parent myself. Okay, so I'll now just talk a little bit about the brain development of children with ADHD. So in order to know how these children learn, it's important to understand how it differs. So ADHD is a neurodevelopmental disorder, which is, the brain structure of children with ADHD differs with, with children without ADHD. So based on studies done on brain development of children with ADHD versus a control group, it's commonly found that, there's some delay in brain maturation. So what this means is that children with ADHD's brain develop in a normal pattern, but with some delays by a few years in some parts of the brain as compared to other typically developing children. Okay, so this includes areas of self-regulation skills, executive functioning skills, and this delayed maturation really impacts how the child cope with the emotions that they feel, how they react to these emotions, and they tend to overreact on seemingly small issues. So for example, the child can't find his pencil and throws a big tantrum for a few hours. Even after finding the pencil, they may take a while to calm down. Okay, and executive functioning skills, they are required for self-regulation, for executing and adjusting goal-directed behavior. So we'll talk more about executive functioning in later slides. But first, I want to just share a case study about this child. So he's a 6-year-old boy who was undiagnosed with ADHD when first seen. So he presented with some features of ADHD, such as hyperactive tendencies. So he ran at the clinic lobby, ran to the room, started walking around to take things from my cupboard. He was actually a cheerful boy, always smiling and laughing a lot in the sessions. And he's quite candid and, quite spontaneous when he's responding to conversations. So as my sessions involve some sitting down to do tabletop tasks, he had a lot of difficulties remaining seated. So he will stand up in the middle of a task and then wander off in the room to find something that to him seems more interesting. And his attention span is like around 5 minutes in the session of the tabletop task. So both parents were working, so his grandmother is in the session together with child. Okay, so I also received some feedback from the preschool teacher on how he was in the classroom setting. So he was quite similar in that he's unable to sit long in lessons, and he will disrupt by walking around the classroom, lying down on the floor, and then teachers will mention that he'll exclaim, I'm bored, and start disturbing his classmates. So it also seems like he displayed some poor social skills in that he will play with friends for a while, then he will get into arguments, and then friends not wanting to play with him. And then he insists on doing things the way he wants it to be. And then he gets quite upset when his friends doesn't want to follow what he wants to do. So class teacher did share, that they are not sure what they can do, because when they try to manage his behavior, he can become quite reactive also. So subsequently, just to share that I saw child for a few more sessions for intervention on some of his literacy skills. So it's found that, after a while, I found that he can be engaged to sit down to do tasks when it's really interest-based and motivating for him. So he's also excited to get like star points when he completes some tasks. So some of the activities that he particularly enjoyed was word hunt, which is looking for words around the room in a challenge with me, and also board games that I used to teach some phonological awareness. But of course, he's going to have moments where he just feels bored again. And then that's where, movement breaks can be helpful for him. We played, he was interested in some bubbles in the room, and we played for a while before, he was willing to resume another task. So later on, child went to primary school. So I was updated on his behavior in the new school environment. So he seems to be showing quite a lot of difficult behaviors in having difficulties adapting to the new school environment. And caregiver often receive a lot of regular calls about child. So what he did was he threw chairs in the classroom. He ran out of the classroom and the teacher is not looking. So when asked, he simply said, no, he's bored of learning. He wants to go home. So school had a lot of to and fro communication with parents. And they felt that, maybe they can fetch child home around recess time, because that's roughly when he will start wanting to go home also, as they are also learning to manage some of the behaviors. So subsequently, parents did decide to follow up with the doctor, and then they went for the ADHD assessment, where he was then diagnosed with ADHD. Okay, so this case study is really to just show how ADHD can sometimes present in a child with the subtype of hyperactivity impulsive. But just to take note, there's also children who may not be very easily observable, especially when they are the inattentive type. So they may look like they are daydreaming in the classroom, and they may not be as disruptive. So sometimes it's quite easy to kind of miss some of these symptoms. Okay, so I'd like to discuss this Brown's model of executive functions. In fact, in ADHD, it's a framework developed by this Dr. Thomas E. Brown. He wants to shed light on the challenges faced by individuals with ADHD. So at its core, ADHD, as mentioned previously, is characterized by difficulties in regulating and controlling goal-directed behavior. So these are known as executive functions. So Brown's model identifies 6 key executive functions that are commonly impaired in individuals with ADHD. So I'll just explore each of them in a bit more detail. So first, we have activation. So this activation refers to the ability to initiate and organize tasks. So often people with ADHD may struggle to begin the task, especially those that they perceive as dull or something that they will require sustained effort. And starting and organizing these activities can be a significant challenge. Okay, and then they also have focus. So this executive function skill involves sustaining attention and maintaining that effort over time. So it's difficult for individuals with ADHD to stay focused on tasks that, as mentioned, are not engaging or interesting to them, and then that will lead to being a lot of distractibility and that reduce persistence in completing the task. The third one is effort. So it really pertains to the capacity to regulate and maintain energy and alertness. So they will have trouble sustaining that mental and physical effort to to complete that task, and that results in a lot of feeling fatigue and decreased productivity. Emotion regulation is another aspect that I mentioned about, the emotional dysregulation part. So it's really about, managing and regulating the emotions to facilitate the task engagement and completion. So people with ADHD frequently experience these difficulties, which can lead to impulsive behavior, emotional outbursts, challenges in managing frustration. The fifth one is memory. So specifically working memory is impacted in ADHD, which refers to that ability to hold and manipulate information in mind over short periods. So these difficulties in working memory can make it really challenging for individuals to follow the instruction, to remember details, to organize their thoughts effectively. And lastly, we have action, which encompasses the ability to monitor and regulate actions and behavior. So individuals with ADHD often struggle with self-control, inhibition, and monitoring their own behavior. So that can result, in impulsive actions, poor decision-making skills, difficulties with self-regulation again. Okay, so it's important to note that not all individuals with ADHD will experience the same impairments in all 6 executive functions to the same extent. But these functions are still considered like primary symptoms of ADHD and contribute to that characteristic of ADHD, such as inattention, hyperactivity, and impulsivity. Okay, and so I guess the idea is that once we know what executive function skills are, we do hope that it will provide us these necessary tools and support to really come up with some strategies to help the individuals with ADHD thrive in their personal and academic lives. Okay, so I want to just show this really colorful graphic that I found. I thought that it was quite easy to look at, and it kind of summarizes executive functioning skills through behavioral categories. So when we see this at a glance, we can also understand how executive function causes the behavior that impacts learning. So I just want to give like a few examples of students with some of these difficulties. Okay, so let's imagine a student who has difficulties sustaining attention during class lessons or while reading textbooks. So they become, easily distracted by the external stimuli or their own thoughts even, that leads to, misinformation and decreased comprehension of the subject matter. Or maybe you might come across, a student who becomes easily frustrated when facing challenging tasks or when receiving constructive feedback. So for example, a teacher commented that he spelled a word on the paper wrong again, and then he suddenly threw the paper on the floor in response, So this emotional response can really hinder their ability to problem solve effectively and persist in that learning, as they may become quite overwhelmed or give up prematurely. And you can also imagine like a student with working memory difficulties, right? So they can struggle to follow multi-step instructions, to remember this key information or organizing their thoughts during discussions. So this can result in a lot of incomplete or inaccurate responses, a lot of difficulties with grasping some complex concepts or challenges in recalling previously learned materials. Okay, so this kind of example really demonstrate how executive function impairments can significantly impact a child's learning experience in the classroom. Okay, so when it comes to learning, right? So these are some of the effects they can have on like reading, math, and writing. So in reading, children with ADHD may skip words or lines due to inattentiveness, and then it makes it challenging for them to follow the flow of the text. They may also struggle with reading comprehension and fluency as they add or they replace the words as they skim through reading. And it can be difficult for them to stay focused while reading because sometimes they are also like distracted, and that can result in poor understanding and retention of the info. Additionally, impulsive behavior and that distractibility can interfere with decoding the words or recognizing patterns. So they have to reread the sentence a few times to process the meaning. In math, so it can also affect the different mathematical skills. Inattention and poor focus again can make it difficult for children to understand and follow the math concepts and instructions. And problem sums usually need some level of comprehension, which I've mentioned is something they can struggle with. And they may have difficulties with mental math and calculations due to working memory challenges. And that can lead to errors or difficulties in retaining and manipulating that information. So for organizing and sequencing steps in problem solving can be challenging. So things like multi-step problems, it can be quite hard for them. And additionally, for the need for sustained attention during math activities can be particularly demanding for children with ADHD. For writing, they may have difficulty maintaining focus and attention during the writing process, okay, leading to incomplete or disjointed sentences. So they can miss details, forget punctuation marks or capitalization, and they may struggle with organizing their thought and ideas, which makes it hard for them to structure and sequence their writing. So these poor working memory skills can also make it challenging for them to retrieve and use that necessary info to put into their writing. And it can lead to them to start trying to complete this work quite hastily. So remembering that one of the executive functions involves effort, which can make it challenging for them to wanting to go back and check their their work again when they already finished a piece of work which they found challenging in the first place. Yeah. So again, do keep in mind that these difficulties can vary amongst the children, and some may or may not experience some of these challenges. But it's still good to be aware of the potential areas that can affect overall learning outcomes. Okay, and what all this eventually lead to is making careless mistakes in their work, or not being able to complete their work on time. And I believe most preschools may not have homework to bring home. And some primary schools may be like primary 1. But I think it differs in between schools also. But they may have something like home activity projects that children may need to complete once in a while. And children with ADHD is highly likely to forget the homework they have to do if they are not reminded, or they may forget the instructions on what they actually need to do. Okay, so I've divided a strategy into 4 areas on helping a child with ADHD learn better. Some teaching strategies, tips on helping children with ADHD develop these organization skills, and managing the behaviors in the classroom. Okay, so one of the external factors that can help children with ADHD is the classroom environment. So do consider providing flexible seating options, so they can benefit from having that freedom to choose a seat that suits their individual needs. So you can include the use of stability balls, standing desks, or alternative sitting arrangements that allow for movements while maintaining focus, like a resistant bands. So it's best that they also sit close to the teacher in front of the whiteboard. So if you see the picture here, and imagine that the child with ADHD is sitting at the back. So the child has to block out so many distractions from the vision line of sight. Okay, and it's also best if they are not directly beside the door or window where there's more distractions. Okay. Do have daily class schedule shown in the classroom that they can access easily. And we'll talk more about visual schedule in our later slides also. Another helpful strategy is to have pictured labels for toys with the printed words. So in a way, this minimizes the steps they need to figure out where each toys should go. All right, so imagine you are the child in a classroom and the teacher says, okay, children, take out the activity book from your bag and do page 3. After you have finished page 3, you do page 4, and then give it to me once you have completed for me to check. Oh, and don't forget, write the date on the pages too. Okay, so when you hear this instruction, right, it sounds a little long, and it can be overwhelming for children, especially one with ADHD. So by the time they are at their bag finding the activity book, they may have forgotten the other instructions already, because remember, their working memory may not be that great to hold too many information, especially one that's given just verbally. Okay, so do give one instruction at a time and at the point when you want the behavior to happen. So Russell Buckley, a retired psychologist, right, who specializes in ADHD, informs that children with ADHD needs to hear the instruction at the time it should be expected to occur, not earlier and not within many other instructions. Additionally, do maintain eye contact to ensure child is paying attention when you give the instruction. Instructions given verbally is also best accompanied by a visual, such as writing the instructions on the board as a reminder. Okay, and let's talk about the importance of adding movement breaks to the daily schedule. So you see, like, physical activity is really like a power up for these children. So it helps them release all that extra energy and get back on track. So here's what you can do. You can plan short movement breaks throughout the day, in between tasks. You can let them stretch, do some jumping jacks, or take some quick walks around the classroom. And this break really boosts their ability to concentrate and stay focused better during lessons. If it's not too hard, you can allow for child to use unobtrusive aids to fidget with, such as blue tack, spinning rings, erasers, TheraBands such as this one here, or pencil toppings here. So you can also get child to be more involved to help out around the classroom. So they can be the line leader, ensuring everyone is lining up, helping to push in chairs or give out materials to their class. So for upper primary children, you may want to try getting them to give something to the next classroom or help out during the assembly. So this also helps in giving them that added confidence in their abilities, because remember that they are so used to hearing more negative words that can affect their self-esteem. So we do want to make them feel more confident of themselves. Okay, so most children with ADHD struggle with time management. They have something termed like time blindness. So they may become wrapped up with what they are doing that they forget what they need to do next, or they can't recall how long has passed since they started on a task. So it really benefits them to have strategies to externalize this time for them. So these clocks here, is shown as a visual reminder on the time and helps them to stay on track with the schedule. So if you know that there's 10 more minutes left before the lesson ends, preempt the class and let them know, how much more time they have left to complete. It's really helpful for the child to know, to prep themselves to complete the task they are doing, or to start packing up because they may need more time. And it's definitely good to address it as a class rather than just telling the child with ADHD specifically, because we want to make it a more inclusive classroom setting, right? Okay, and a visual timer such as this one here is also useful for a child to understand the concept of time, especially in the younger age group where they can't grasp what you mean by 10 more minutes. So they can actually see the time going lesser and lesser by the color. In the classroom setting also, it's helpful to visually show child what is next on the schedule so they know what to expect. So I believe most childcare I've seen has something like this, maybe more common in the younger age group. For the K1 and K2s, you may still want to include a version of this schedule in the class, especially if you have a child who may have ADHD or who needs the extra help with externalizing time to keep them on track. Okay, talking about time, I want to just share this Pomodoro technique that can be quite helpful for ADHDers. So it's a simple and effective way to really manage that focus and attention during tasks. So just really here's how it works, okay? Let's say you have a math activity that needs to be completed. So you will think about how long you may need to complete it in sets of 25 minutes. So you set the timer for 25 minutes and you call that the work period. So during this time, the child will give their full attention to the math activity. So once the timer goes off after 25 minutes, it's time for a short break called the break period. So you'll set the timer for 5 minutes. And during this break, the child can do something enjoyable or relaxing, like stretching or walking around the classroom. After the 5-minute break, you will repeat the cycle, another 25 minutes of focus work followed by a 5-minute break. So you continue this pattern until the task is completed. But of course, you can adjust according to the child's needs. If they can only focus for 15 minutes instead of 25 minutes, of course, you can do it in that 15 minutes block instead. Okay, the other one is breaking down the task into manageable chunks with focused work periods and short breaks. And that helps children with ADHD maintain their attention and avoid building up the feeling of being overwhelmed or that restlessness. And plus, it's super helpful for these children because they can see their progress at each small step and they know exactly where they are starting and ending. So you can think about an activity your students usually do in in the classroom. So for example, a typical routine like toothbrushing. So there are actually quite a few steps involved in that routine. So first, they need to go to their bag, open the zip, take out their toothbrush set. Then they have to line up and then head to the bathroom. Then next is time to open up their toothbrush set, put toothpaste on the toothbrush, and finally brush their teeth. After that, still need to gargle and put their toothbrush set away. So when you actually list it out, that's a lot of steps for children to go through just to do that one activity that sounds simple. So imagine listing this out in a visual checklist. So it's a way for the kids to see exactly what they need to do in the routine. So this kind of visual guides can be applied to learning activities also, and not just routines. So it can make it less overwhelming for the child to complete the activity. Okay, and not only does this help kids to stay organized, but it also builds that confidence and independence. So they feel that, okay, I can do this on my own, step by step, and feel a sense of accomplishment as they check off each item on the list. So we also want to give them that empowerment. Okay, and you can also have less distracting visuals on the activity page to minimize distractions. And another way to break down a reading task can be showing one line at a time instead of the whole paragraph as they are reading, like this picture shown here. And graphic organizers can also be helpful to use in listing down the steps. Okay, let's dive into how active learning can benefit children with ADHD in the classroom. So active learning strategies are especially valuable for these students as they provide opportunities for engagement, movement, and multisensory experiences. So you can use things like group discussion, hands-on activities, or role playing. So that really helps them to participate actively through by expressing their thoughts, practice their listening skills. It's really having their voice valued also. And hands-on activities can really allow them to experience learning by doing, and it helps them to stay focused and retain their info. And role playing, I think that's quite common in a lot of preschool childcares, that they will actually develop their imagination, enhance focus, and really important social and problem solving skills. And remember that children with ADHD learn well when it's interest-based. So active learning allows them to experience the learning in a fun way. Another one is a multisensory approach, which uses two or more senses and enhancing the learning experience for them. So when we incorporate various senses, we tap into their strengths. We want to boost their focus, and we want to make that learning more interactive and enjoyable. So children with ADHD often respond well to like visual stimuli, for example. So when you incorporate a lot of visual aids, such as diagrams, colorful visuals, they can actually visualize this info and make the connection. And then you can also combine that with like music, rhymes, or sound effects to enhance. So using, for example, songs or chants, to remember multiplication tables, or even reading stories with expressive voices. Okay, this is a framework just to share a little bit is the gradual release of responsibility. So it's really getting them to be independent learners. So at the beginning of a new concept or skill, the teacher takes on that role of the model or the expert. So they provide clear instructions, demonstrate strategies, and guide students through the learning process. As we move along, the teacher starts to share that responsibility with the students. So this is where you can transit to a more collaborative approach, and students actively participate to ask questions and work together to solve the problem. And then next, you will have the guided instruction stage where they are given the opportunity to apply what they have learned to try it independently, but with some support and guidance from the teacher. So it's really like, imagine you are riding a bike with training wheels. So the child have some autonomy, but the safety net is still there. And then finally, you want them to get to the independent learning stage. So where students take full responsibility of their learning, they can apply that strategy and skills they have learned without direct guidance from the teacher. So throughout this process, the teacher can provide feedbacks, monitor progress, and intervene when necessary. So we want to create that supportive learning environment that fosters independence and also build their success. It also allows them to kind of build that confidence and develop all the important executive functioning skills. But of course, do note again that this framework is not a one size fits all. So it's it's flexible, it's adaptable to meet the needs of the child. So if you feel that child requires more support, more scaffolding, please do so, and others may also progress like more quickly to independent practice. So you really tailor it to the child's unique abilities. Okay, so if you recall the executive function skill that children with ADHD struggle with, organization is one of the areas. So 60 to about 80% of children with ADHD underachieve academically because of problems with work production and being consistent. So some of the challenges they may face, like losing or misplacing items, difficulties keeping their toys or items away, or not remembering the homework that they need to bring to school. They may also have clutter as they pile things up. And then they might also not, have materials needed to complete tasks. So when they want to do an art piece, they started on it, then realized they forgot to take along the paint. Then they took the paint and then realized they forgot the paintbrush. So a lot of going to and fro also. So one effective strategy is really providing, again, visual cues and reminders. So this can include the use of notebooks or checklists to help children prioritize tasks, manage their time and keep track of assignments and deadlines. And then, implementing color coding systems to help children categorize and organize materials. So for example, this kind of, color coded folders or trays to really label for different subjects or types of tasks. So that visual differentiation really helps child to quickly locate and retrieve the materials that they want to find, and it reduces that confusion and frustration. If you can, do provide labeled trays like this one that is place for children to submit their work, and if they can't complete it within the lesson, another tray to place incomplete work. So they know where to go to find the incomplete work to continue again, and they don't forget about it. Okay, and also to reinforce again, do give them time cues, give them cues on the time left, which allows additional time to pack up or finish something they were doing in the classroom. Okay, so let's first acknowledge that all children want to be good. Okay, so labeled praise is a specific type of positive reinforcement that really involves providing specific and descriptive feedback to children about their behaviors or efforts. So it's not just good job or well done, but it's best that it also comes with highlighting that specific behavior or skill that the child demonstrates. So for example, if you want to say, instead of saying good job, you can say great job staying focused and completing your homework on time, or some of these other examples here to really help them. So this helps children with ADHD understand which behaviors are desirable and expected in the classroom. And by explicitly stating what they did well, we provide clear guidance and reinforcement. And remember that they need this clarity because they may struggle with understanding social cues and expectations. And remember to give this praise when the behavior happens, as it's more impactful and they understand what behavior you're referring to. And remember to celebrate the small wins and the process with the children without just focusing on the outcomes. Okay, and non-verbal supports can also be used to manage behaviors in the classroom. So for example, when you show 5 fingers up, it can mean take a 5 minutes break, or it can mean everybody pause and listen to me. Having that clear expectation really helps, or it can come in the form of a visual posters also, so it's always there as a reminder for children. Okay, and rewards are powerful motivators that can reinforce this desired behavior and encourage children with ADHD to stay on track. Make sure the expectation and desired behaviors are clearly defined and communicated to the child. So do consider providing immediate rewards that the child can see or experience right away. So this makes them helps them make that direct connection between that behavior and the reward. So it can be just something small like stickers, tokens, or points that can be exchanged for something that they want. You can try to make it like a game also, because they really enjoy things that seems engaging like a game, like a board game. Okay, and consequences are definitely important for really teaching them about responsibility and accountability. So you can let them know the consequences in advance also, and use these consequences as an opportunity for learning and growth rather than just to punish. So it's really to encourage that reflection on their behavior and discuss alternative choices or strategies that can lead to better outcomes. So for example, a loss of privilege could be not getting to choose a preferred toy to play, or having lesser time to play if their behavior affected the time they take to complete the work. So peer support strategies can also make a difference for the children. So it's really creating that positive and inclusive environment. So I think buddy system is something that some schools have adopted. So they have parent children with maybe ADHD with supportive peer buddies who can be there for them throughout the day to be like a peer tutor and to help during learning activities. Cooperative learning is also something we can incorporate in active learning too. So we encourage that collaboration and teamwork among students, and really giving the child a chance to interact with their peers, communicate and support one another. Something similar to a buddy system is transition buddies. So it's really to provide that support during transition between activities, because sometimes they may find it challenging to navigate that transition between tasks, in between routines that can disrupt their focus and organization. So of course, it's important to choose buddies who are patient, empathetic, and willing to lend a helping hand. So remember that you're not alone in caring for this child. So do work with other parents and other professionals in your school or outside by regularly, sharing info and updating about the child. So whether it's face-to-face or or emails. The goal is to really have open and honest discussions that contribute to the child's success. So you can find out more about their home learning environment or strategies that works at home that you can try in the school, or sharing that with the parents also. You can work together to share that decision making and responsibility and aim towards a common goal for a child. Okay, so on top of all the other classroom strategies, you can also share some strategies with your parents. And some of you here are actually parents yourself, and you find this, if you find this helpful for your child, you can apply it too. So things like having a child-friendly calendar for them to keep track of important dates. The older children can also write inside the calendar of what they want to keep track of, providing learning corners if possible. So just a table could be okay, just an area that the child knows they should go to when it's learning time, with necessary materials in a quiet space. So routines are very important for them to know what they need to do within the home setting. So for example, setting daily routines for lunchtime, homework time, rest time. So some parents both may be working, so they can also start with just small routines in the evening too. So remembering that the Pomodoro technique just now is something that you can also apply in the home setting when you want the child to do like their homework or projects. And then, child emulates adults. So parents should role model what they preach. If you feel that child is using too much screen time instead of reading, do note if you are doing the same role modeling for a child to model after. Okay, and you can also do something like this file or folder that indicates assignments to do, and the other side is like assignments to give to the teacher. So it really helps them to keep track of what to bring to school, and it also helps yourself to know what they need to, what they have not completed or completed. Okay, so if you have parents, if you have memo from doctor or reports from other professionals, please do share and advocate for your child's needs in school. And while I did put this under strategies for parents, I think that teachers can also advocate for children with ADHD or other needs in the classroom if you feel that there's a concern, or if you think that child can get more support. Okay, this is my last slide. Okay, to summarize just some key points. So I know there's a lot to absorb, but if anything, take this away. Remember that children with ADHD benefits from movements, breaking down tasks into small steps, active learning, a lot of visual aids and reminders, and lots of rewards and labeled phrases for the behaviors that you want to amplify. So also do, work with the strengths of the child, and let's create a positive growth promoting environment for these children to thrive in. All right, that's the end of my slide. Maybe I'll hand the time over to Pooja.
Thank you very much, Jana and Moonlake. I'm impressed by how much really helpful information we've managed to cram into 1 hour. We'll take a short break now, so it's 10:05. Let's all come back at 10:15. So we'll see you back at 10:15 then. Thank you. Welcome back, everyone. I hope you had a quick short break. I will now be handing over to Vargini. She'll be taking us through her tips on supporting social and emotional growth in children with ADHD. Vargini, over to you, please.
Thank you, Pooja. I'm just going to share my screen. And here we are. So my particular part is understanding ADHD and inclusive practices in the classroom. And so thank you very much for giving me this opportunity to present to this wonderful audience. It's a privilege presenting on such a platform to such esteemed colleagues who want to find out about ADHD and understanding it. I wish I had this very type of resource helping me throughout my journey through teaching, but you're doing great jobs, and thank you, Moon and Jana, for your presentations. Now, I've been working in the area of education for 26 years. Mainly it's been in the area of inclusion and behavior, but it was only my two previous jobs did I really work with children in the primary setting with dysregulated behavior and challenging behavior. And I've worked extensively with classroom teachers and head teachers and parents to establish an inclusive practice in the classroom. what I did find out is that some of these behaviours put these children at risk of exclusion, and that when children are excluded, that's a very, very sad thing to do, and that affects their life chances. So in working with the teachers to put in strategies earlier on, we can mitigate some really challenging situations for the family and the child. I've worked closely with educational psychologists and the SEN teams in schools to try and implement these strategies and get assessments underway. So today these are my objectives, is to recognise the early identification of ADHD traits in the school setting, to identify an inclusive framework to support children with ADHD traits, use a case study to identify what worked, and to identify strategies to support the inclusive practice in classroom for ADHD learners. So, like I said, I have worked extensively with children with social, emotional, mental health needs, and those with ADHD traits. Some of these children display very extreme behaviours in the school. They are disruptive, antisocial behaviour and uncooperative behaviour. They showed emotional outbursts. Some of them displayed frustration and anger and verbal and physical abuse. Some of them were withdrawn and depressed. They displayed very risky behaviours and anxiety and self-harm and oppositional behaviours. But what I noticed about these children, and I've worked from primary right through to secondary, that these were common features, that actually behaviour is a form of communication. And what that communication is there is an unmet need. And if we peel the onion skin of these children, we could more often than not look at there is a learning difficulty that is affecting their behaviour. And that is the behaviour communicating that actually we need to intervene. But some of these children had very common traits. They had an inability to follow instructions and distracting others and disrupting the learning, which can frustrate teachers. They were attention seeking, they had a short attention span, they were unable to work with others, lacking confidence and low self-esteem, and unable to complete tasks. Some of them were very provocative, so they were very impulsive and spoke out of turn, and they often were the class clown, trying to garner the others, trying to draw other children into their particular off-task behaviour because it's successful for them. They often they were often forgetful and disorganised with their homework or the right book, or turning to the right page where they needed to start the new work. And then this term called rejection sensitive dysphoria. I noticed that actually some of these children reacted disproportionately to the trigger, most often to the word no. And there would be a big meltdown or a big tantrum, which would baffle teachers or parents as to what was the reason and why. But understanding that actually some children with ADHD are very sensitive to this particular predicament. And they were often argumentative as well. So in working with them, we tried to work through reasoning and restoring the relationship and how we communicate the desired behaviour. So this is a resource I found on YouTube. YouTube is great, and it will be available to you on this QR code, but this particular video talks about the research of interviews of children with ADHD and how what needs to be in place in the classroom to ensure that they are cared for and they can thrive. What they often said was that the teacher was very, very key to them. Their relationship with teachers was what helped them navigate the minefield of the classroom. And often or not, sometimes when adults shouted at the children, they found it very hard to engage or to change, or to improve their confidence in the classroom. So what is key here is relationships. Relationships are the key drivers for any institution or our human existence. And it's very relevant in the classroom. So in working with, in my role as the SEMH, Social Emotional Mental Health Advisory Teacher, I worked with schools in implementing a framework. And what I noticed is that teachers often got overwhelmed with so many strategies and when to implement it and why to implement it, and systematically work through an action plan, not do everything at once, but put them in place so to secure that area of that child's development. Often working with educational psychologists, they write a report and so many recommendations. And what I did for schools was put it in a framework. So these are the 4 components for a positive classroom and inclusion framework. Relationships and well-being, that isn't so necessary to implement in the classroom. And so that routines and rituals, the type of connections you make in the classroom, how do you connect with children in the morning or throughout the day, how children attach to their caregiver, because actually the teacher is like the parent. We call it loco parentis. It's the primary caregiver. And so if that child has secure attachments with their adults, they're able to feel secure and safe to enable and take the positive risks in their learning, not the risks in their behavior. A sense of belonging is essential, and that's one thing I've realized working with children that are at risk of exclusion, is sometimes they don't feel a sense of belonging, they don't have a place in the classroom, and ensuring that the child, that dynamic is changed and the level of engagement. Then there's the emotional regulation, the effective responses of the child, the effective responses of the adults around the child, parents, how we teach them to regulate at critical points through the day, and how we teach them with emotional literacy. Then we go on to the type of organisation that Jana mentioned that actually have an impact, because the organisation in the classroom can have a huge impact. That could be the executive functioning, the resources and the types of intervention. It could be metacognition here, the types of routines around transitions from morning break to back into the classroom or after lunch when there is a sugar surge in their bodies, and how do you regulate that? And then the types of differentiation, the types of learning that is conducive to helping the child to learn. That could be multisensory type learning, or hands-on type learning, or learning by doing, or chunking the work. And then obviously the environment, how do we reduce the distractions? Then it's important to look at how we communicate so that that child receives the type of information at the right emotional energy. What I often tell my teachers is that communication is the transmutation of emotional energy into thinking, and it's how we deliver that communication will determine how children respond. So here is, I would put this particular area as restorative practices, the visuals that reduce the cognitive load so that children can enact the task, the types of scripts we say for positive behavior, and the non-verbal communications that allow children to read what we're trying to get them to do. So Jana talked about a case study of a boy. I've worked with lots of children. Lucia was one child that stuck out for me because she had a brother who had ADHD. She's 10 years old, and she had many challenging behaviors. And she was the type that, with boys being the sort of go-to archetype of an ADHDer, we're just trying to change that myth that actually anyone could present with ADHD. And she had high levels of anxiety, which impacted on her behavior in class. She often disrupted the smooth running of the class, and she took the teacher's attention away from the teaching, and she was attention seeking. And during the transition times, she was highly dysregulated. And often the senior management had to be called to deal with her, which then affected her relationship with the teacher and the people who were trying to intervene to de-escalate the behavior. Also, quite notably, she had mental health difficulties, a lack of sleep because she wasn't able to get that quality sleep so that she could process the information and she could do the relevant development of her brain and her body. She was unable to engage in tasks. But really looking back and peeling the onion skin of her particular traits is that she had those typical co-occurring needs. She was calling out. She walked around the classroom when she disengaged with the learning. She was socially immature, and she wasn't, although she was popular for the wrong reasons, she found it hard to retain friendships. And for a girl at 10 years old, that's huge, because actually for girls, a social network is really important for them to make and thrive throughout their development. And she was very immature. She lacked the inattentiveness. She had inattentive and lacked the focus to complete tasks. She was very, very negative about herself. She sabotaged everything. She ripped up. She had low self-esteem. She couldn't attempt some of the particular tasks, and we had to help her raise her self-esteem through the engagement of with her teacher and what strategies we put in. Often she was distracted, she was messy, and she called out. It's important to know that looking at learning, that actually it's not about acquisition of knowledge or task, well it is, but it's how the brain works. And in some children, it's important that we ensure that their brains are working optimally so that they can engage. Now, ADHD is a neurodiversity and is a neurological disability which can affect the way the brains function. And whilst it can affect behavior, it can affect parts of the brain and other aspects of the learning. So the sensory cortex is essential for the sensations and movement. So if that is triggered or not fired up, that's when movement is needed and planning. So we were talking about, Janawan's talking about executive functioning, and the prefrontal cortex is very essential, is the executive of the brain, which helps with the logic, the rational thoughts, the decision making, and the planning. And in ADHD, this is underdeveloped or inhibited. The amygdala is the survival brain when a situation triggers a particular child to go into fight, flight, and freeze mode. The hypothalamus is about managing the emotional regulation, sleep, appetite. The hippocampus, again, is about working memory and learning, and then the brain stem is around the physiological aspects of a child and their development. And any aspects of these developments can impact on child's learning, which could come out as a learning difference. So it's important to know that actually ADHD affects motivation, and an ADHD brain struggles with motivation because the brain produces low levels of dopamine, and dopamine is a neurotransmitter that helps with attention, memory, the reward. So where there's that experience where they've had a reward and they can sense that, they can sense it again, and then that reinforces that neural pathway. Sleep and motivation. And with Lucia, you could see how if she didn't have enough sleep, she didn't have enough dopamine, so she wasn't able to attend, which then affected her memory and then her motivation in the classroom. So everything has a knock-on effect. So we had to look at her in totality, not only in the classroom, but actually what's going on before with the parent, and then what we were going to do with her afterwards with the professionals. So how ADHD affects the brain, again, we were talking about executive function and the prefrontal cortex. That is the front part of the brain that is important for attention and behavior and emotional responses. And for ADHD and attention, this is easily switched off. And when that is switched off due to an emotional response, then they're unable to attend to learning. Then the basal ganglia, which is the neural circuit system that regulates communication. So sometimes when there is an emotional incident or situation, the brain's function to problem solve is bypassed. And so they go into survival mode. And this is when this is shortcut and could cause inattention and impulsivity, which is very prevalent in ADHD learners. The limbic system is the emotional system which regulates emotions and how emotions are experienced, whether it's a disproportionate outburst and the intensity. And deficiency in dopamine in the ADHD brain can really affect the limbic system and may result in restlessness and inattention, and also the emotional volatility that we see. The reticular activating system is a major relay system between the brain and pathways. A dopamine deficiency may cause impulsivity and hyperactivity. So you can see how the lack of production of dopamine can impact the brain and its development and its capacity to learn. And so that's why working with a clinician to look at regulating the chemistry of the brain is so essential, so that that learner can make those neural pathways and learn to get to be successful, and then have a knock-on effect around their confidence and their self-esteem. So it's not in isolation, it's all in a knock-on effect. But Lucia's mum had mental health difficulty. She suffered from depression, and her brother had ADHD. So what is common with that, many children who have ADHD, it is a genetic thing. And more often than not, it's the working holistically with the family to put in the strategies and the school to ensure that the development of the child is maintained and secured. So it's important to address emotions and teach learners how to manage their emotions, and also get that sense of belonging. Now, ADHD brains need a sense of belonging. It's important for them because their social network will be is very important for them to feel secure and be able to learn successfully. And normally what children say is that when they feel that they can't, when they're shamed, they can't learn, when they've got this fear of learning, fear of failure, they can't learn. When they've experienced a pain, so sometimes experiences beyond the school or whatever their emotional makeup, which makes them feel some emotional pain, they are unable to learn. So children need to feel secure, seen and heard and empowered to feel a sense of success and human and academic skills. What I want to actually say is that my whole ethos around education has been inclusion. So I've worked in the field of inclusion for 20 years, and my passion is inclusion. And I have worked very hard to ensure that schools try and make these children successful against the odds. And some of these children will come from very difficult family situations. But what a quote that I came across really resonates with me about inclusion education. And inclusion education is where all children and young people can engage and achieve through being present and participating in learning and belonging. And that really does resonate with me, because I had so many children who were being excluded from school because they were unable to be in the classroom, but then working strategically with the school to implement the framework, we were able to get these children back in and being successful. So one of the components is this essential part, which is relationships and well-being. This is a really important driver to help with ensuring that actually children feel secure. And with Lucia, she didn't have a sense of belonging through her behavior, but then we had to work on how we could build in routines and certain rituals to enable her to feel secure and ready to learn. So she had a soft start in the morning. She was often late, which wasn't helpful. So whenever she came into the classroom, that was a trigger. So we worked with her mum to see if, and the mum worked in the school, to see if she could go to breakfast club and come in 5 minutes earlier before the children, the rest of the class, so that she had that check-in with the teacher. The teacher spent a lot of time in that period trying to attach to her so that she had that sense of security, so that she felt a level of that if there was something going on in the classroom, she knew that her teacher would be the primary caregiver to support her. She had we needed to explore her sense of belonging. So she had a particular seat. It was not necessarily at the front of the classroom, but it was to one side where she was able to go there. And if she was able to regulate by doing some activities that helped her to regulate, like mindful colouring, and then get back on track, she was able to do that. Also, she had a particular role in the classroom. She gave out, she sharpened the pencils at the end of the day, and that helped her get that sense of belonging. Also, the level of engagement was necessary. So we had to put in an activity which was highly motivational and rewarding for her. So she liked helping the younger children. So if she made good progress through the day and she got the stars on her sticker chart, she was able to go down for half an hour to nursery to be an effective role model. So that was helping her self-esteem throughout the school day. One of the things that is important is to build positive relationships and a belonging. And this particular video, which I can't show you today, but is on the resources that I've provided, is that actually teachers and adults getting down to the level of the child, making that distinct eye contact, that connection, that co-regulation that helps a child to calm down and increase the feeling of emotional and physical safety is essential. And you would see in this video that actually the adult does it very simply. She puts in specific routines that enables a child to feel a sense of belonging, but you can see that actually they're happy, they're secure. And you as adults and the educators are the big resource in enabling well-being in the classroom. So with effective responses and emotional regulation, that was the next sort of component we needed to work on with her. And we worked with her mum around how mum responded in the morning when there were stressful points and Lucia was being oppositional or defiant, which raised mum's anxiety levels, which then mapped onto Lucia. We helped the teacher recognize the responses, her responses and the children's responses, and then what we needed to help do in the classroom to regulate. And also the emotional literacy as well. So Lucia had some interventions with emotional and social skills to help her understand the emotions behind her feelings and then have the right communication about it. So triggers in ADHD, again, I was like saying, this is something that is new to me, but it really does resonate that actually, why are children disproportionately reacting to triggers? And rejection sensitive dysphoria is not a medical diagnosis. It is a way of describing a type of emotional dysregulation. And some of the triggers to these emotional outbursts and emotional dysregulation is perceived criticism, perceiving things as a rejection or a fear of failure, experience severe anxiety, the procrastination and difficulty starting tasks, and reading and miscuing social situations and overreacting. So we had to look at triggers, look at the behaviors, and then look at what needed to be implemented for Lucia. So initially, it was a very chaotic classroom, and it was important that her teacher and all teachers have, and their responses are modeling what we want to see in the child. And in a stressful situation, a child's window of tolerance during stressful times is narrow, so are the adults. And we need to take that into account so that we can adjust ourselves to ensure that everyone, all the emotional heat is actually de-escalated. So sometimes when we have a narrow window of tolerance, there is shutdown, there's blow-ups, and then in between that narrow window of tolerance is the learning and the listening. And it's important that the adults regulate themselves and the emotions of the children. So what I noticed, good practice, was that teachers were putting in mindfulness after lunch, that 5 minutes settling time where they're able to take the breaths and to notice themselves in the moment and notice their bodies was what helped. And for Lucia, that was very helpful. Again, she had to come in 5 minutes earlier. She did 5 minutes mindful coloring, and then she transitioned to mindful therapeutic input by the teacher. And it's important, like Moon mentioned, that it's important that teachers and caregivers, parents, take care of themselves. That analogy around the oxygen mask being put on the adults to allow them to have that window of tolerance wider and extensive to be able to deal with the challenging classroom sometimes. So teaching about mental health is important, and you can do that at early years right the way through. And it's important that we as society have mental health and well-being at the forefront. Teachers are also under additional pressures and stresses to deliver the curriculum, and it's important that we balance everything out with a curriculum that helps with personal health and care, and that actually the children are progressing in the way we want to. So there are challenges, and it's important for self-care. So how do you, what steps do you take to prepare yourself for the morning? I know I used to have to listen to calm music on the way to school to help my anxiety levels come down, and you know, that sort of things that, and we had therapy dogs. So I know some schools don't allow that, but I was able to check in with the school dog in the morning and have a little pet. So it's important to know your own limits and ask for support. Can't stress that enough, is that dealing with challenging behavior is a team approach. Sometimes they can make you break. So having a regulated adult that knows a child available to kind of intervene de-escalates the situation, and then you can come back and repair and restore the situation. So it's important to know that a dysregulated adult can never regulate a dysregulated child. So it's important that we notice what's going on in ourselves, take the measures to regulate or seek support, and then act accordingly to what we know works. Again, it's important to promote well-being and mental health in the classroom, being patient and calm, getting that sense of core within you and centering yourself, being assertive in dealing with challenging behavior. And being assertive is through your communication and what you expect of the child. You surround them with healthy adults that have that sense of humor, that can notice them, that can bring them in mind, and can deflect difficult situations and diffuse difficult situations healthily. Being consistent in setting expectations and following through, that's important as well. It's not the severity, it's the certainty as well. And when an adult has this level of curiosity, one of the statements I always say to teachers is that being curious about the behavior instead of furious helps understand where that child might be coming from. It may be that they're disengaged with the learning, or there's some emotional pain that they need to be able to talk about. So it's important as adults to have that unconditional regard for certain children that find school difficult, and try and be curious. Actively listen through emotional coaching. Again, I've got scripts around that and a video. Teaching children how to be safe. And we do that through zones of regulation. Recognize positive choices and good behavior, reaffirming that. Positive affirmation. Sometimes a child just needs a hug. And if a parent notices that, that's good. And as a school, you might have a positive touch that reassures a child, but you can't beat a hug sometimes when a child is going through something difficult. Having high expectation, believing that they can do something and that they are able to do something, and then building time for connections and sharing thoughts and feelings. If you've got circle time in your classroom, that's great, or just debriefing. The other area which comes along, and Jana explained it so perfectly, is the organisation in the classroom and what goes in to help de-escalate some of those behaviours that can get out of hand. And if we can put the executive functioning around planning or impulsivity, movement breaks, that sort of thing, that's really helpful. The routines around transitions, again, that might be visual timetable for all the children. It helps for an ADHD children, but it will help all children. So some of these are generic strategies that will help the class, not individually only, but it's helping a child, a now and next board. So sometimes you have a now, next, and then. So you've got, now we've got to do 5 maths questions. That will take 5 minutes. There, next we've got break for 20 minutes, and then we've got mindful colouring for the next part of the day. So breaking the day up and helping the child know what's coming up ahead will help to reduce some of that dysregulated behaviour triggered by anxiety. Again, it's the type of learning that is put in place. Some people asked about how do we promote social skills. Group work is important, partner work is important. It needs to be modelled and explicitly taught, and then reinforced. And then again, what environment is, how the environment isn't conducive to support the child. Now, I've been in some schools where there are open classes, and there are about 4 or 5 children with ADHD, and you can see they just stand out. So the open classroom is not helpful because there's so many distractions. and their train of thought is broken. So in working with the school, I've tried to work in ensuring those classes are put into closed classrooms, and so that type of learning is reinforced to allow the children to engage. So with Lucia, it was important for her to have a safe space. Now, safe spaces in schools are precious, but if you could think creatively, you're not always going to have these particular tents or a corner. It could be a reading corner. It could be somebody's office who can co-regulate with that child. It could be the bedroom set up like this. But it's important if they're having a situation and they're managing themselves and they're going to their safe space to self-soothe and reduce that anxiety in their body and dissipate whatever they're feeling, we should explore that. And it's important. So with the zones of regulation, we look at the types of behavior that child might present and the reason why, and then what are the proactive ways to reduce that behavior. So if it's an angry outburst, what are the triggers, and then what can they do to help themselves? Normally, occupational therapists will work with schools to develop this, or speech and language, but as an advisory teacher, I worked with teachers to develop that. And it's important to know where the safe spaces in the classroom, in their home is. So if it is their bedroom and they're taking 5 minutes or 10 minutes to regulate, allow that to happen. So then one of the biggest things I worked in schools with is how to develop restorative justice. So normally ADHD learners have this over sense of justice and argue when they feel that they are unjustly reprimanded and sanctioned. So restorative approaches are used to help children manage conflict, use the language, use the thinking and the emotional literacy that goes with managing conflict in the classroom, and give them the tools to help manage conflict. Using visuals is important, again, to reduce cognitive load. I've got loads of scripts around positive language for positive behavior management on my Padlet. So you can use no blame approach, positive behavior management, emotional coaching, so many different scripts that can help a child regulate or co-regulate when you're working with them. And also, obviously, the non-verbal cues are really important. So in restorative practice, these are the fundamentals that we work on. What happened, who was involved, and what were you thinking at the time, and what have you been thinking and feeling since, and who has been affected, and what do you need to do to make it right? Not just saying sorry, because sorry is just a word, but through the thinking process, allowing that child to build those neural pathways around the language, the thinking, the emotions of a situation, so that they're primed to working through conflict down the line. And I've worked with secondary school children where there's a fight, and that really helps. For girls, you don't do that immediately. Boys, they can sit in a room and sort things out for themselves. But restorative practice is important. Again, scripts are really useful to helping build in effective management, and therapeutic approach. So welcoming a child, there's a script for that. I wonder, using the curiosity again, I wonder what's behind you throwing that ball at that boy's head. I wonder if there's something going on between you. That sort of language that you can construct to allow that child to think beyond just being impulsive. Again, modeling is important, and reassuring again that school is a safe place. The adults are in charge. We want them to be happy and secure, so we're dealing with everybody in the same way. Containing scripts are important for emotional health and well-being. Again, encouragement. Holding a child in mind. Again, you could, on Monday, you could say, oh, well, Lucia, I thought about you over the weekend and I saw, I don't know, a dog just like yours. And it was, so holding a child in mind helps that child know that the adult cares. And that is another way of helping a child feel secure. Again, repair, restore and repair is important. And there's some scripts that I've got on a resource there. Again, it's important to know that your words matter. When that means is that actually that energy, that however it's communicated is received, and that is how the child will manage a situation in that as it comes up. If we say, if we are positive and rephrase things positively, we can see that the child would actually do things positively. And whilst Lucia was pushing the buttons, the teacher had to reframe how she used her voice and what she said to reinforce the positive behavior around her learning. So it's important to know that actually ADHD students, learners, have positive traits, and we need to flip the paradigm into what they can do and reinforce their positive attributes as to what they, instead of what they can't do. So what I noticed is that ADHD learners are very intelligent. They're empathetic, they're creative and enthusiastic, especially when things go wrong. They want to be the first one to help you out, especially with computing issues. I often had that, and my trusted learner with ADHD was able to problem solve that situation for me. They're intuitive, resilient, they're very observant, spontaneous, passionate, and courageous. This is now, I'm going to hand over to Moon, who's going to talk about some resources that is available to you. So thank you, Moon.
Thank you, Vargini. And it was a wonderful reminder at the end, to summarize the strengths of ADHD children and students, because I think that when we look at them from a positive, strength-based perspective, that is the key that they need to thrive. It's the affirmation and encouragement to counter all those 10,000 negative feedback, the 20,000 negative feedback they've been hearing all their lives. So if we can remember to approach them as individuals, relate to them from an empathetic level, that'll be very helpful. I know we're running out of time and we want to really make sure that you have time for questions. So again, Vargini's done a great job with the Padlet here on resources, organized by different topics, and you can scan the QR code at the bottom right or the bit.ly to access those. Unlocking ADHD has a YouTube channel with all our previous webinars that give you in-depth information for parents, for youth, for adults, and also for like teachers on how do you understand and approach ADHD in a very practical manner. Please visit our website. You can scan the QR code to go to the Unlocking ADHD website. We do have a Facebook support community. So if you know of parents who have ADHD children, you can share that with them. It's a private, safe space, about 2,600 people on it currently. And for those who had asked questions earlier about youth, we have Unlocking ADHD Discord server that appeals more to youth and young adults. They could also interact on conversations there. We have a general public Facebook, LinkedIn page where you can hear about our events, and learn about, things about ADHD that might be of interest to share. So please visit that. You can scan we also have resources in official languages. So we do have microsites in Mandarin, in Malay, and in Tamil, because we did an event on these languages before. So there's also a video in these 3 languages on the diagnosis and management of ADHD. You will be able to get the handout later. So please, take your time, explore all the resources. For Unlocking ADHD, again, our mission is to empower ADHDers and their families to live life to the fullest. And we're addressing the 3 issues that ADHDers struggle with the symptoms: impaired relationships, underperformance in work, including school and life, leading to lost potential. So really it's through the awareness, the acceptance, accessibility to resources to support and help them, to have that sense of achievement from incremental changes, the growth mindset, and advocacy, which we're engaging in with the different ministries and different stakeholders to create a more supportive environment for those with ADHD and the families that support them. So please, check us out. Keep in touch with us. We do have group coaching, and there's an interest form there that you can scan. We have an Empower workshop specifically for parents to help equip them with executive function understanding so that they can support their children, particularly those in upper primary, lower secondary. We are a registered charity, and the social service agency would love to interact with you, do workshops, do talks for schools, for corporates, for parents. So please scan the codes. We also have a place where if you want to support the work we do, please donate. I will hand the time back now to Pooja. Thank you for being such a wonderful audience, and look forward to answering your questions.
Thank you so much, Moon and Vargini. Fantastic sharing, and we have so many great questions. So what I'm going to do is I'm just going to pick the ones where I think it would be helpful to hear directly and live from the speakers. And also because since many of you are requesting a copy of the written Q&A, we don't usually do that, but for this session, we are going to upload it onto our website. So that's www.include.sg. But you'll just have to give us about a week or so to edit it and get it up there for you. So don't worry about copying or taking notes from there. If I could just start us off with our first question, which is, when the child says, I can't. So is this actually refusal or defiance, or is it that they really can't because they lack the skills, or they can't, drum up the motivation because we've heard about, the brain chemistry that they have? And how do we help in these situations?
That's actually a very good question. And I think fundamentally because, every individual with ADHD is different. So part of it actually is understanding the particular personality of that child or student, so that you know whether it is a can't or a won't. And what also is important is that sometimes when a child says can't, it's because they've already learned to be helpless. There are too many setbacks in life, so the sense of self-esteem is not there. So that's why they cannot understand that maybe it's something they could do, because they don't feel that they have that ability to do that. So sometimes giving them small little tasks where it's easy to have a win, and then celebrate it, is one of the ways to build that slow bits of building blocks of self-esteem back and the confidence. So, affirmations are important. Catch them doing something good. So that's how you transform from the helpless to the, more confident. But in terms of the will, the won't and the can't, again, is to really see whether, look beyond the iceberg, below the iceberg. What is the effort required? Praise the effort, because, sometimes a child being able to understand that there's empathy from the person that's interacting with them would be in a more conducive mind space and emotional space to be able to connect, and therefore, because they want to please, whether it's the teacher or the parent, then there's more buy-in, there's more motivation to do something more positive. But I'll leave it to my other expert panelists to maybe input on this question too.
Okay, so I do have, the children who will say that, I can't do something and all that. And then often we also take a look at, what was the reason for them saying that I can't. And sometimes we may find that they've been told so many times that, no, oh, you are doing something wrong, this is not correct. And they feel kind of like a bit more negative towards that learning aspect. So they will feel that, every time I do something is not correct, and I lose that motivation to even want to try. So I just quickly just say, like Moon mentioned, that kind of like immediate response to saying, no, I can't do something. So, really when you are working with a child and you see that when you try some of the skills, you can actually kind of monitor, that the child is actually struggling at some parts of the task, and then you can try to kind of simplify, or like Moon mentioned, breaking down the task to really see if they do like small tasks. When they can do it and they feel like, that kind of achievement, are they willing to go to the next step? And then from there, we kind of get the child to feel a bit more confident in their abilities, that they can do something in, the activities. And, when they say that, knowing that is it really that they weren't, but they actually have the skills, it really boils down to all that motivation and the interest in the task also. Yeah.
Yeah, I would affirm that as well, but not sometimes looking at what they think they can't do. So asking them, okay, what is it that you can't do? So that they verbalize, I don't know where to start, miss. So that's one thing. Or I don't know fractions. And then you can break down the task to their level of how they make it meaningful for them. And then say for them, it's the script. It's saying, okay, well, we all find things difficult, and I want to see how well you can push through this, because I know you can. Remember last week when you did 10 questions, you were really successful. So let's do 5 questions now, 10 minutes. And so you need to frame it for them, what they need to do in the time that they need to do it, and then praise that positive behavior. So then you come back after that time, you reflect on the successes and say, I've got a chili challenge for you. Let's see if we can stretch it a little bit. Are we ready? And then see if we can scaffold their approach to tasks. So it's scaffolding and the language and using differentiation.
Perfect. Okay, the second question takes a slightly different tack, which is, I mean, I think we know that a lot of the challenges can be reduced if there's a proper diagnosis and treatment, not eliminated, but reduced. So how do we convince parents who are hesitant because of, the stigma, or they're worried about their child's future? How do we convince them that getting a diagnosis would actually help?
I think that for parents, sometimes there's an underlying fear, right? As you mentioned, Pooja, about stigma. So we have to show that the benefits outweigh the costs, or the perceived costs or challenges. And, like in my slides, I shared about some of the benefits of a diagnosis in terms of accessing, our learnings, the support needed in school, reducing the risk of, mental health issues or minimizing it. Those are important. And also the child's self-esteem. We want to really give the children, the students, the best chance that they have to succeed in life. And, the younger they are when there's intervention, the longer the runway there is to work on this. I also think that we should, at least at this stage, because, as long as we're not a medical professional like a psychiatrist or a clinical psychologist, educational psychologist, we'll try to minimize using labels like ADHD, but more talk about the symptoms and the impact of those symptoms on their learning, on everyday life. And I think parents can connect with that better, and to frame it such in a way that it is of benefit, not just to the child, but actually to the whole family, to get these issues addressed. So very much on a factual, rational basis, rather than letting people revert back to the emotional, because Vargini shared about the emotional brain, right? And then there's a fight, flight, or freeze kind of thing. So we want to avoid that, because there's a lot of things that we can't control when it comes to emotions. So we'll just stick to the facts. And hopefully that would be helpful. And also show maybe stories of people who have done well with ADHD, open about it, because that might also give encouragement about the possibilities. Pass it to my panelists too.
Yeah. So I guess like Moon mentioned, not actually labeling the child yet when we don't actually know, because there can be so many factors that contributes to the child's behavior. So I think importantly also that, to understand what is ADHD as educators. So the fact that, a lot of you are attending this webinar is a great step. So when you have that knowledge, you can have that informed conversation with the parents and really address their concerns effectively. And also to put yourself in a position with the parent that, you are here to, to let parents know that you want to help the child thrive, you want to help them achieve their full potential, and it's not just complaining about the child's behavior, because sometimes some parents may feel that it's just negative feedback, but we want to kind of highlight the potential that they could achieve. And some parents, they do take some time to process this information, because sometimes in earlier years they may want to, or we just want to monitor, we hope that the child will outgrow these behaviors. So you can also talk about how early intervention is really beneficial, but at the end of the day, the underlying thing is that we still have to respect the parents' decision, but you still have to continue to give that support to the child, to the parents, and to just let them know that communication is always open. Yeah.
Yeah, again, it's reaffirming what my colleagues are saying. Again, it's a challenge with parents to overcome the judgment that is, and the stigma that is put on labeling behaviors and a child. So sometimes looking at diagnosis to qualify for access arrangements is a big thing that helps parents to come to terms with, actually, that child couldn't finish the maths higher paper and does exhibit some of these behaviors, and it's better for them now, and the IDP course where they have to be a bit more demanding of them, it's actually beneficial to identify it earlier. And then they take that into university. Some universities have a disability department, and they like to hear that actually you've overcome some difficulties and that you've identified the strengths, and that actually you're an asset to the situation, to the class, and that it's never going to be an anchor around your neck. It's going to enhance you to learn the best way you can.
Thank you. Okay, since we have so many educators here, we also seem to have a lot of questions about, what can you do in a mainstream classroom? And there are questions saying, oh, things like standing desks or fidget toys, might be distracting or are not used in this context. So also wondering if we require a bit of a mindset shift here in order to be inclusive for these children, because in AWA's experience, we are aware of local MOE schools that use all these tools to create a more nurturing, inclusive environment for the kids. So I was just wondering if the speakers would like to address this.
Okay, so I agree that, I think it takes a mindset shift to really trying to see how you can make it a bit more inclusive. So if, if certain fidget toys you feel that it may be distracting to other children or even to the child itself, so do have your own discretion on what may work in your own classroom setting. So it doesn't have to be something big, it can be something really small, like I mentioned, like just a blue tag in the child's hand. Some children, they actually get that kind of stimulation, that kind of fidget, just to roll something around in their hands while the teacher is teaching. And also, I guess, putting all these kind of like movements within the classroom setting really takes a few changes in the way that the curriculum is probably being done. Maybe like when you have to incorporate some movement breaks in between some of your tasks. It does take a bit of planning also, like when are you going to put it in, or at which time is it appropriate. Yeah, so I guess I saw one question about like TheraBands could be like a big thing, like a bit more distracting. So if that doesn't work for your classroom, it doesn't mean that you must use the TheraBand, and it can be something else that is more beneficial for the child in terms of movement, but less distracting also. Yeah, maybe Virginia or Mulik may have other ideas also.
Yes, so yeah, in working with the classroom teachers, especially within the unit of the SEMH provision, we had to create a calm box. So some of it was additional resources like the fidget toys or the therapy or the blue tack, or it was different too. So if we are expecting children to line up in order to go to assembly, and that child can't line up in their name order, they can be with the teacher and set the whole class off. So it's different instead of expecting or additional. Again, if the child finds it hard to listen in big spaces and is triggered, they may need to sit next to their key adult, may need to have that blue tack and an exit if they are presenting with dysregulated behavior. The non-verbal cue can say we're going out and we're just regulating for 10 minutes. So we're looking at additional or different approaches and being creative. You don't have to put in a lot of resources. Remember, the teacher is the resource. Your curiosity about what lies behind the behavior and problem solving and putting something in and seeing whether it works is the best way to move forward, I think, because you will know your child and the situation.
Great advice, Vargini, for parents as well as educators, I think. I think, Moon, in some of your written answers to the questions, you alluded to this need to first provide emotional safety and connection when you have a situation where a child has learning issues, emotional issues, behavior issues, and it can seem like, a bit overwhelming. Which angle do we tackle this from? So would you like to address that?
That's a very good question, Pooja. And sometimes, we are practical people, right? We know there's deadlines, exams coming, and we just want to cut to the chase and go quick to the strategies. But sometimes we have to slow down to go fast, as they say. It sounds so paradoxical. But at the very base of who we are actually are the emotions, that need for that sense of attachment, secure attachment, that sense of safety. And we recently, Unlocking ADHD, had a webinar featuring Seth Perla, who's a specialist in executive functioning and helping struggling students to shine. And he said, we need to get to the basics first. We can maybe share top 10, top 5 strategies to do well in exams, right? But if the child doesn't buy in, or the student doesn't buy into this, there's nothing that we can do. It'll be just very short term, if at all. So we need to still get back to that connection, that empathy. The child needs to feel heard and safe, build that relationship, and then the rest will follow. It seems so counterintuitive because we just want to get there. And it takes a lot more work to build that relationship, but it's important to have that good foundation so that we can move on. And I found it in my own kids too, because there were times when, we had so many power struggles, and that's very common, whether it's teacher and student or parent and child. But how can we address that? And Dr. Dan Shapiro, who's an expert in this area, says it's really the collaborative problem solving. And to be collaborative means they need to feel heard, that you respect their opinions, without judging them. And then let's look at the problem objectively and how we can work as a team to resolve it, to address it. So I think we have to still address the emotions first. But it doesn't mean that we do one and then not do the other. We can still do it simultaneously. But remember that the emotions are the foundation. I'll pass it to my fellow panelists to comment.
Yes, I would, again, reiterate that, because some of the times the learners, it's new for them. Their emotions are the way of expressing what's going on in their brain. And they may have not had the modeling or the approach to help them calm down, to problem solve, and to identify what was the problem in the first place. So it's important to really invest time for that, and know that you trust in the process, actually, and that emotions are the things that drive action and thoughts, and vice versa. Thoughts drive behaviors and emotions. That actually, if we can address the emotion, put in a strategy, and be successful, that actually we are moving them further along the situation. So yes, it is putting in the effort there.
Yeah, Vagini, I particularly like that slide of yours that says, shamed children can't learn and scared children can't learn. So yes, that's definitely it. Okay, a question maybe from those who are struggling a bit more with the really impulsive, aggressive behaviors from children, either dangerous behaviors towards themselves, like climbing or playing with dangerous objects, or towards others. What advice would you have for these educators?
Shall I jump in? Yeah, I think I've worked with very at-risk children in the past, and I've had to try and get them on side, really work with me. So try and develop a positive relationship, understand what they're interested in, and then try and work with them. So I've worked with boys in an inner city school who are affiliated with drugs and the gangs. So we did some project work with them. So I did a project where they created a manual for electronic bikes. So it's doing something that they're interested in, building the relationship and the bond, and then drawing the network of charities, parents, local authority providers, anyone who can support and problem solve about what are the protective factors of those children, what factors are positively impacting on the child, what is negatively impacting on the child, and come up with an action plan on how to address it. A team approach at this point is what is necessary, because nobody has all the answers, but this is a multidisciplinary approach is necessary to address very risky behaviours. So there, that's why, and one of the interventions I worked with is that actually a lot of ADHD children want to be firefighters. So I connected with a firefight initiative where they were able to ensure that the children were able to go for an afternoon and get role model of somebody that they affirm that they look up to, so that they can get that level of engagement and that positivity.
Great. Okay, we just have a few minutes left. So maybe from all the questions that you've all seen, is there something that you would want to address live? So maybe we can just do it in our usual order: Moonlake, Jana, and then Vargini.
Okay, whoa, now I'm at a loss of words, right? Okay, I think really fundamentally the most important thing, and we keep on emphasizing over and over again because it is so important, but it needs to be said, is really, again, the relationship. Work on that, invest that time in it because it will pay off. And I like what Vargini said earlier about, instead of being furious, be curious. Okay, so, not just the relationship with the child or the student, but it's also managing our own emotions, right? And try to make it with a sense of curiosity so that we don't feel that personal, that it becomes personal. It is not personal. Okay, I'll pass it to my other panelists.
Okay, so I did see, I think the one that some of the questions were talking about, using like rewards or consequences and things like, sometimes they feel that after they do some of the rewards, they may not feel that that is very, it may not work for every child, or the child may, revert back to like the behavior. So I guess, sometimes when we want to use like rewards and consequences, we also kind of need to find what's the motivation of that child, what really makes them want to do or display the desired behavior when we want to do that reward. Because sometimes we think that when we give certain reward and the child actually is not even interested in getting that reward, so they don't feel that they need to really do that kind of behavior. So when you use the rewards and consequences, I guess it's really important that the individual children in your classroom on how they would react to certain things. So like for children with ADHD, they really like things that are very immediate. So when they feel that, when I do something and I just get that kind of immediate. So labeled praise is actually a very effective tool and a very simple one that you can use, because you just need to immediately address it by telling the child, oh, you did a great job when you did this and that. So the child gets the immediate feeling of achievement. And that is actually a form of reward that can be used also. Yeah.
Yes, somebody mentioned about how do you support behavior management where there's challenging behavior in the classroom. And it's about understanding the distribution. It's positive behavior management and what are the techniques for that. And helping children identify what they're doing at a time and when they need to do it. So positive behavior management, catching a child being good, if you've given them an instruction and now the ADHD learner isn't paying attention, you mentioned that actually we are listening now, and then you cue in that particular child who's not paying attention by using their name and saying the instruction and asking them, what do we need to do now? So framing the language, again, it's about framing the language that switches a child on to what we need them to do. A structured, systematic classroom with the components that are thought about with the learners in mind. If there is a task that is hard for anyone to access, that's where you're going to lose them. But if you've got differentiated activities where engagement can be sustained, that's really great. Again, knowing what sort of strategies work. So if saying for, again, a child, I want to be able to send a good news postcard home to mum today because you've done this, this and this, it might prime them to thinking, okay, this is what I need to do. This is the purpose of the day. So it's positive management, managing the dynamics in the class, and then managing challenging behavior and de-escalating, always de-escalating in every way.
Thanks so much. We have so many questions. I think we need to have you back for a second time. Could we just quickly have the ending poll questions? Because I think our team at Unlocking ADHD wants to hear from you how this session has helped. And I really want to thank you, Moonlake, Vargini, Jana, so much for joining us. It's really been a great discussion, very thoughtful questions and answers. We really benefited from all your insights. And I think that's reflecting in the poll here right now.
I also just wanted to say, please focus on the strengths of the child, because that is really one of the ways, if you can identify the strengths, amplify it, that is really one of the ways to help them thrive, to move forward. We still, of course, want to support the challenges, but for ADHD children, again, the carrots work better than the sticks. Okay, and we also want them to be able to look back and say, this teacher changed my life. This teacher changed, the way I looked at things. This teacher, for my own daughters, right? They weren't doing well in school because sometimes they didn't like the teacher or they didn't like the subject. But if the teacher could make it fun or have that empathy, they started liking the teacher more, then they actually started liking the subject more. So teachers have an amazing influence, on individuals' lives. And we would love to, and we are going to be sharing more stories on Unlocking ADHD about the role that teachers have in actually putting people on the right path, like shifting that narrative, because we want to also recognize, the efforts of teachers to do that and amplify that more. Yeah. Thank you for all you do.
Thank you, Moonlake. That's a perfect wrap up. Sorry, we also have a poll from AWA's site to find out what you think of our webinar, as well as for you to suggest additional speakers or material or resources that you want to see. So if you could just take a moment, the QR code is up on the screen. Just take a moment to help AWA hear from you as well. The slides we will share we'll share the link to the slides, excuse me, in the following slide. But as I mentioned, the written Q&A will also be up, but you'd have to give us a week or so to get that up. And that you will find on our include.sg website. The QR code is also here. And you'll also find lots of other resources there on inclusive education. And of course, also now you know that Unlocking ADHD has a whole lot of resources for you as well. So hopefully that will help you along on your inclusion journey, we hope. Please stay connected with us. You can subscribe both to Include.sg and Unlocking ADHD to be kept informed of relevant talks and materials as we come up with them. So we will wrap it up now. I'd really like to thank Unlocking ADHD, our technical support team, always very important. And of course, all of you who've joined in today, giving us your Saturday morning. Those of you getting a break during the June school holidays, hope you have a much deserved rest. And thank you all, and we will see you again soon. Thank you.